The World Health Organization highlights that many countries are moving towards eliminating malaria, among them Madagascar, Senegal and Zimbabwe. But the report warns that in many countries, progress has stalled. There was an increase in malaria cases of more than 20% in 8 African countries from 2015 to 2016, including Rwanda, Nigeria and the Democratic Republic of Congo. At the same time, funding for malaria prevention and treatment has levelled off, reaching $2.7 billion in 2016, less than half of the 2020 target.
That amount of funding internationally has plateaued. Possibly it's reached the realistic maximum, and it's always been assumed, indeed it's been important, that countries themselves should commit to funding malaria control. And I think the big opportunity now is for those countries to step up and realise that this is good value.
Overall, it is Africa that continues to bear the highest burden of the disease, with approximately 401,000 deaths in 2016, a slight decrease from the previous year. Despite earlier fears, the malaria parasite does not yet appear to be developing drug resistance in the region.
The current treatments within Africa, they work very well. There is resistance in Southeast Asia, which is spread, which is potentially going to be more of a problem in the future. Insecticide resistance has spread much more. That's the resistance in the mosquitoes.
In addition to improving the coverage of existing methods of malaria prevention, the WHO calls for urgent investment in new tools.
More research is needed to develop an effective malaria vaccine that could cover the populations that at the moment have high malaria rates and that perhaps don't use the available interventions even when they are being funded.
Several malaria vaccines are under development. The WHO is planning a major trial of the so-called RTSS vaccine starting next year in Kenya, Ghana and Malawi. But its latest report warns the world is at a crossroads. Without better funding and more effective rollout of tools to tackle malaria, the progress made in recent decades could be undone. Henry Ridgwell for VOA News, London.